Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. In the last previous class, we have discussed the most important theory-based questions, where the all possible questions and the key point on the psychosexual theory, psychosocial theory, psychoanalytical theory, Eric Erickson's models, and Sigmund Freud models we have discussed, and other questions. Most importantly, everything of golden point chanting we have repeatedly done. Okay, so the concept based questions and the scenario based questions, one line questions. So many things we have discussed in the last previous class. So in this today's particular very important class also, we are going to discuss those very important, easy and important questions. So that is must required for the revision. So it may feels difficult to you people, and this is because of the theory based content, and which is very important content, and it is actually a rank deciding content, right? So I will try to make this particular session completely easy and very easy. So all you have to do is to sit with pen and notebook, take a note, take a golden point which is coming from my side, and brush up the thing immediately after the class, right? So good evening beta, very good evening, very good evening to one and all. Good evening. Welcome you all once again to the Master Nursing classes. Yes, in the today's session, we will discuss the golden points on the community health nursing and yesterday's questions which were remained. Okay, so those questions plus a community health nursing, a golden point chanting will start. Okay, so almost we have done with the all the practical based questions since the prelims crash course till the last class. Okay, so now the completely class is focused over the rank deciding session, where your marks actually you people need to improve. So those area I am concentrating. Okay, so stay connected with the class, watch the class till the end. Okay, know the differentiation between the things and how to choose the options correct in the your main exams. So that is most important. Okay, so reading the thing and forgetting the thing is not going to helpful to you people. Yes, reading the thing, analyzing the thing, applying the thing, and choosing the correct options when you sit in front of the computer in your exam, that is going to decide your rank, bacho, right? Very good evening beta. So this class is most helpful for the upcoming Norcet 8 mains exams plus the RRB nursing superintendent exams, right? So even again after the entire session, again after the exams, I will come with a screenshot, bacho maine bola tha, right? So what we have did same in the prelims, right? So that is the thing is here. So yes, beta, good evening. So almost all of you will join the class. So we'll start the class now, right? So who all are watching the master nursing classes first time, the first thing you people have to do is that is to hit the like button, and if anyone is watching the first time, to hit the subscribe button. Okay, so who all are watching this class now, so please hit the like button. So we'll start the class. Fatapat hit the like button. And all are watching the first time master nursing classes, so fatapat hit the subscribe button. So we'll start the class now, right? So well done bacho. Okay, so we'll start the class with this beautiful motivational quote. The quote is here: it does not matter how slowly you are going, as long as you do not stop. बच्चों, अगर आप स्लो लर्नर है, you have just started to learning now, it doesn't matter how slow you are going. It brings a negative changes when you stop. So that is the reason of slow learning and consistent learning is better than the stopping the things, right? So don't never ever think to stop your studies because of the one bad result, because of the one good result. Okay, so you are getting a selection in the prelims means don't come to that kind of the confidence that I will crack the means. No, the consistency is required here because of the very high competitions in the nursing field nowadays, right? So yes, it does not matter how slowly you are going until you do not stop, right? So don't stop, always keep learning, keep growing, having keep updating your knowledge, so it will help in your future, right? So with this beautiful motivational thought, we will start the today's class. A very, very important class. What does prevalence measures in the epidemiology? What does prevalence measures in the epidemiology? So, what is epidemiology? Epidemiology is the study of the distribution and determinants of the disease in a particular community. How disease is distributed in the community, what is its rate, what is its ratio, what is its proportion in the community. So we'll study everything in the epidemiology. Okay, so as a part of the epidemiology, so we'll study the prevalence. Okay, so in the prevalence, what it actually measures? Option A is studying the number of the new cases in the population. What we can say for this one, bacho? Yes, fatapat do comment. Option A, what we can say, the number of the only new cases. Number of only new cases. What we can say for this one? Yes, the number of new cases are called as the incidence. Okay, this is what we call as in the incidence, right? So then what is the a total number of cases where new cases also included and old cases also included in a population at a given point of the time? This is what we call as in the, yes, the prevalence. What we call this one as in the prevalence, right? So then the total number of the death due to the disease. Okay, if there is total number of the death are very high, so we call this one as in the high fatal disease. Okay, this what we can call this one is in the highly fatal disease or highly dangerous disease. Okay, high fatal disease, and the total number of the death due to the disease is low, so we call this one as in the low fatal disease. Okay, so not dangerous. Low fatal means not dangerous, high fatal means most dangerous. Okay, so here the option D is the number of the recovered cases. So this is not means for the prevalence here. Okay, so our answer correct goes here is the option B. The prevalence is the total number of the new cases plus old cases in a population at a given point of the time. So that is what we call as in the prevalence. Okay, so here we have studied the what is epidemiology, what is prevalence, what is incidence, and what is fatality. Okay, so high fatality means most dangerous, low fatality means least dangerous. Okay, so here in the prevalence we are having the another very important two terminologies where it confuses the students, that is the point prevalence and period prevalence. Okay, so here the word itself telling it's a point prevalence means it's a just for a single or particular point of the time. Okay, for example, so how many cases are currently totally present in a community on the 1st of the January. Okay, at particular single point of the time, that is the 1st of the January. Total number of the cases in the community, that is the point prevalence. And the period prevalence is the word itself, it is telling us it's an period prevalence. What is the period prevalence? A total number of the cases from December 31st to the January, sorry, December 1st to the next year January, means for a certain period of the time. That may be a 1 month time, that may be a 6 month time, that may be a 1 year time. Okay, so the total prevalences we are measuring in a certain period of the time, that is what we call as the periodic prevalence, and in particular one point we are measuring the prevalence, means that is the point prevalence. Okay, so let me quickly distinguish between these two things. The point prevalence is a specific point of time. Okay, so in the period prevalence we are measuring for over a period of time. For example, a point prevalence we will measure that is the flu rated on the January 1st. Okay, so how many total cases of the flu are present in on the only January 1st. Okay, in the period prevalence, the total number of the flu cases from the 1st December to the 31st of the December, 1st January to the 31st of the December, means a complete 1 yearly for a 1 year period. So we are measuring here. Okay, so here for a period of the time, here at the only single point of the time. So that is the very, very important. Yes, so only the current cases at the point of the time is the point prevalence. All the cases during the period is the periodic prevalences. Okay, so simply if people have to grab the option. Okay, so by focusing over the whether it is a point or whether it is the period. Period means for a certain period, like from the 31st of the December to the next January. Okay, for the point means particular one day, that is the flu on the January 1st. Okay, hope it is clear to you people the difference between the periodic prevalences and point prevalences, right? So Here's the next very important and very basic question that may directly strikes in your upcoming RRB nursing superintendent exam. Okay, so that is the father of the public health. Who is the father of the public health? Father of public health. Option D is telling that is the Hippocrates. Hippocrates is the father of the, yes, Hippocrates is the father of the medicine, or we can say he is the father of the first true epidemiologist. First true epidemiologist is the our Hippocrates, and father of the medicine is the Hippocrates. How to remember, sir? HM. Okay, so that is your school headmaster. Remember, okay, HM is your school headmaster. He is the Hippocrates is the father of the medicine. Okay, so very simple thing. Then comes to the Louis Pasteur. So please write 2 words on the Louis Pasteur. Okay, it's a very basic question, and I'm waiting for your answers in the comment box regarding the Louis Pasteur. Okay, then comes to the John Snow. Very important and very basic question. He is the father of modern epidemiology. Okay, modern epidemiology father, who is, that is the John Snow is the father of the modern epidemiology. Then father of the public health is a disease, that is the cholera is the father of the public health. So remember, very important. Don't choose any person as a father of the public health. So the father of public health is a disease, that is the cholera. Okay, because why? Because we call the cholera as the father of the public health, because the cholera is the thing which made us to learn how the public health to be measured, how the public health issues are the solved. Okay, so this is the disease which made impact on the all epidemiologists to work more and to control the things, that's the bad things in the community, and to maintain the good health in the community. So that we learned by the cholera. Okay, so how we have learned wearing the mask and importance of the hand washing the COVID. So that is the thing. So public health measures we have learned during the impact of the cholera. So that is what the reason the public health, father of the public health, we named as a cholera. So it's very important. Okay, so then comes to the next very important question, that is on the difference between the primary cases and index case. What is the difference between the primary cases and index cases? Question is very simple. So I'm waiting for your response and good answers in the comment box. So please do fatafat answer. Yes, guys, I'm waiting for your answer. The difference between the primary cases and index cases. So which of the following best describes the difference between primary cases and index cases? Options A tells the index case is always the first person is infected. No, the index case may be a first person, he may be a second person, or it may be a secondary case. Okay, so the index case does not mean the index case, he does not means that he is always first person. He may be a second case or he may be a primary case. Okay, so why, I will tell the explanation, don't have to worry about them. Okay, then option B, the primary case is always most severe case. No, it may be a most severe or it may be a less severe. Okay, so that does not means the primary case is always most severe. Okay, so it depends on severity, it depends on the how virulent the pathogen is and how the a host immunity is there. So the host or the person immunity is good, so the disease is less severe, and person immunity is bad, so the disease is more severe. Then the virulence means the severity of the disease is more, so the disease is more severe. The virulence is less, so the disease is the less severe. Okay, so that is the things and factors which affects the severity. So the primary cases always doesn't mean it's a very severe cases. Okay, then comes to the option C. So the primary case is actually a first person to contact the disease. Yes, it's correct. Then the second statement, the index cases is the first person to detect it in the clinic. Yes, so this is the a very important difference and only option which is showing the difference between the two terminologies. Okay, so that is very basic and important thing all you have to learn, sir. So we didn't clear about the this particular answer? Yes, let me make a scenario very sweet and short manner and I will explain. Okay, so consider this is a COVID-19 virus. Okay, so this is the a COVID-19 virus and it affected a person A. Okay, so he is the person A, it affected to the a person A. So the infection who is happened to a first person in a community, that person we call as in the primary case. What we call him as in the primary case, right? So from the primary case, it spreaded to the a secondary case. Sorry, it spreaded to the a person B. Okay, so now person B he come to the clinic. He come to clinic, and from the A it may spread to C also. From the A it may spread to the D also. Okay, so this person who is first time infected with the infection, so him we call as in the primary case. From him, so B also get infected, C also get infected, and D also get infected because of the communicability of the disease, right? So among this B, C, and D, the first person who came to the clinic is the our B. Okay, so now we clinically detected B as a first person. Okay, so this B we call as in the index case. Okay, what we can call him as in the index case, and rest these all are the secondary case. These all are the secondary case. Very simple and very important, bacho. So the statement also it is telling the primary case is the first case person contact with the disease. Yes, the first case or the person who contact with the disease is the primary case. Yes, sir. So the secondary, the index is the simple thing. The index case is the first person detected clinically. Yes, sir. So B came to the clinic, sir, first. So we detected B as a first person clinically, so he will call B as in the index case. So this is how it's simply understood. Okay, so all other infected persons from the primary persons, so that is what we call secondary cases. So it is clear and hope it is very clear. So if you found the logic and the answer behind this one, so please thumbs up here, right? So here's a beautiful advertisement for you people. So who are preparing for the Norcet mains, okay, and who are preparing for the RRB. So here is the beautiful chance, a wonderful chance to you people to practice the actual real exam scenario before going to the main exams, to learn all the important questions, all the high yield topics, all the repeatedly asked, frequently asked questions, and all the previous exam questions which how you want to know, and you want to prepare for the non-nursing portion also, you want to practice for the non-nursing portion also, means everything is included in the Vande Bharat test series of the RRB for the same scenario, where you will be getting the 30 model question papers. Okay, so among those, all question papers are as per the your exam syllabus. That is 30 are the non-nursing portion and 70 is the nursing portion, where are selected all important questions from the nursing portion, and in the non-nursing portion we have included all the questions related to the your general science, general knowledge, reasoning, maths, arithmetics, everything according to the syllabus we have added in the portion. Okay, if you want to expose and practice the same thing before going to the main exams, the link is there in the description box. The link is there in the comment box. So you can go and download the Master Nursing Classes app and enroll the RRB Vande Bharat test series. And if you are exclusively preparing for the Norcet mains mission exam, means we are having the golden plan of the as per the exam syllabus and exam scenario. Here we have set the clinical based questions, one liner questions, scenario based questions, priority based questions, updated questions, everything in your Norcet mains missions you will get. Okay, so if you want, you can enroll. The link is a link of the our Master Nursing Classes app is given in the description box and both in the comment box. Okay, so if you want, you can enroll, right? So here is the next very important questions, that is again from the epidemiology. So in epidemiology, the generation time refers to what? What is the meaning of the generation time? Sir, these are the few words like window period, incubation period, generation time, and serial interval. These are the very important terms which repeatedly comes in the exams, and we will get confused for that one. So please make it clear, sir. Yes, the master is here. Don't have to fear. I will make it very easy and clear to you people. So just listen to the class and take a notes, very important. Okay, so the generation time refers to what? So if anyone know the answer, please put your answer in the comment box. And option A is the time between the microorganism entry to detection of the first antibody against it. So what happening here in the option A, it's the time interval between the entry of the microorganism to the detection of the first antibody against it. So this is what we call as in the window period. Okay, so what we call this one is in the window period. Window period. So exclusively we will see this one in the HIV. Okay, so this window period where we will see in the HIV, that is the entry of the HIV microorganism in our body to the duration where our body takes to produce the specific antibody against the this antigen or this microorganism. So that time period we call as in the window period. Okay, exclusively we will see that one in the HIV. So this is not a generation time. So option A I am eliminating. Then comes to the option B, where a time between infection and the maximum infectivity. So this is what actually we call as the very important generation time. It is a generation time means a time taken by the microorganism to exclusively grow and maximally infect the person. Okay, so the time between the infection and to the maximum infectivity. So this is what we call as the generation time. So our option B goes to the correct answer here. Okay, then comes to the option C, that the a time between the entry of the microorganism into the body and the appearance of the first clinical symptoms. Okay, so entry of the microorganism to the first clinical symptoms, every nursing aspirant know the answer for this one. So that is the what we call as this one as in the incubation period. What we call this one as in the incubation period. The most important question, repeatedly asked questions, again it will comes in your upcoming Norcet exam, mains exam, and your RB exam. Okay, the time period between the entry of the microorganism to the appearance of the first symptom is the incubation period, and the time period between the microorganism entry into the first detection of the antibody is the window period, and time period between the infection entry to the highly maximum infectivity is the generation time, and the time between the onset of the infection in the primary cases and the onset of the secondary cases. Okay, so here what we have seen, so this is the primary cases. Okay, so primary cases to secondary cases, this particular time period, so the time period between the primary cases and the secondary cases to happen, so this is what we call as in the serial interval. Okay, so what we call this one as in the serial interval. So interval means the gap. Okay, the serial means the sequence. Okay, this is the sequentially happening. So primary case to the secondary cases are happening. So in the serial, so happening of the serial interval cases means the sequence cases. What is the gap here? So that is what we call as in the serial interval. The serial interval is the gap between the happening of the primary cases to the next secondary cases. So that is what we call as in the serial interval. Hope the concept is very much clear. And if you found the content is quality, helpful, and very important, so patafat hit the like button. Okay, so here is the next very important question in front of you people. So please do read the question completely, carefully, then try to give the best to best response in the comment box. Right, the communicable period of the disease refers to. What is this communicable period here? Very simple questions I have chosen today because these questions are repeatedly coming in the exam, and you people will make mistake for this one, right? So what is the communicable period of the disease? What it actually refers here? Option A, that is the a time between the exposure and the onset of the symptoms. Yes, just we have discussed this one. The exposure to the onset of the symptom is the incubation period. So I am eliminating the option A. Okay. So then comes to the option B, the time during which an infection person can transmit the disease to the others. Yes. So this is what we call as in the communicable period. Okay, the communicable period is the infected persons where he is able to spread the infection to the or the infectious disease to the others. So this is what we call as in the communicable period of the disease. Okay, so then the option C is the time taken for the disease to be cured. So this is not our correct answer. Then the D is the time after the vaccination and immunity develops. So this is also not our correct answer. So option C and D I am eliminating. So just the communicable period means, yes, the just simple thing, the disease where it is taking the time to spread the infection to the others, and the or duration of the ability to spread the infection to the others. So that is what we call as the communicable period. Okay, very simple question and most important question. Then comes to the in public health, the term eradication means what? What is the meaning of the eradication? What is the meaning of the eradication? Bacho, did you heard about the programs in the community, that is the National Blindness Control Program, then a revised National Tuberculosis Control Program, then the National Tuberculosis Elimination Program. Here, are you people able to focus the control, elimination? Okay, so then some programs are there like eradication programs. Okay, so here the control, elimination, eradication, what it actually means here, what it actually means, why this become NBEP. Yes. What it actually means is the very simple thing, they are having their own separate meanings, so that meanings will be repeatedly asked in the exams. Okay, so what is eradication, what is control, and what is elimination? So this is the most important thing all you people have to know about. Okay, so the control is consider this is the community. In this community, a disease is spreading in such a way that it is infecting to the every person of the community, right? So now we are putting a control measures. Now we are putting the control measures, and we are making this disease is no more a public health problem. Okay, but the microorganism is present in the environment, and the susceptible host are present in the environment, and we are installing the those type of the precautions where the disease is not a no more a common health problem in the community. So we call that one as in the controlled condition. Okay, so that is what we call as in the controlled disease, right? So the control means a disease is not a public health problem. So this is, now we can say this one is in the control. Okay, so this is what we call as the disease control. Okay, here the infectious agent is present and host is present and everything is present, but just we have installed the measures and controlled the disease. Then comes to the a very important word, that is the elimination. What is the elimination? In the elimination, so we are completely making the new cases of the diseases and transmitting to the zero. Okay, so we are not allowing the new cases to happen in the environment, but the microorganism is present and all the capabilities of the organism is present, but we are not allowing the microorganism to get onset of the new diseases, means we are making the new cases completely zero. Okay, so completely making the new cases of the disease to zero in particular specific geographical area, not globally. Okay, so that is what we call as in the option A is the example of the elimination. Okay, this is a just a second please. Okay, this is the elimination of the disease. Then comes to the option B, reduction of the disease causes to a minimum level. Okay, so this is not an correct answer. Then comes to the option C, a permanent eradication to zero and worldwide incidence of the infection is zero. Okay, so there is permanently we are reducing the cases to the zero and worldwide incidence of the infection is the zero, means here the disease causing agent or the pathogen is absent from the world. Okay, so the disease causing agent or the pathogen is the absent from the world, so that is what we call as in the eradication. So option C goes to the correct answer here, that is the new cases we are making zero in a specific region or a specific area, so that is what we call as the elimination, where the entire globally we are reducing the incidence to the zero, and most importantly we are eliminating or we are completely destroying the disease causing agent globally, and the disease causing agent is no more present globally, so that is what we call as in the eradication. Hope it is clear to you people. Okay, so it's a very simple word and it's a very important word, so the examiner can throw the question in front of you people in your RRB nursing superintendent exam and upcoming Norcet mains exam. Okay, so then the next very important question is, yes, that is the What is typically used to calculate the case fatality rate? What is typically we used to measure the case fatality rate? Bacho, in the first question, I told to you people what is the fatality. Fatality is the extent of the danger of the disease. Yes, the most dangerous disease means high fatality rate. The least dangerous disease means low fatality rate, right? So case fatality, how we have to manage monitor. So how we have to say the disease is danger or not danger. If from the disease the case are dying more, okay, the lots of the death are there, so we can say the most dangerous disease, okay, the high fatality rate. And if the disease from the disease there is a very less death, okay, so the more death is the high fatality and less death is the low fatality. Okay, so that is how we have to measure the fatality rate based on the number of the death of the cases in a particular area. Okay, so the total number of the disease cases in that particular area into 100 is the how we have to measure the case fatality rate. Okay, so how we have to measure the case fatality rate? So option A is telling that a total number of the death, okay, the total number of the death in a population divided by the mid-year population into 1000. So this is clearly indicating that is our crude death rate. Okay, so total number of the death in a population divided by a mid-year population into 1000. So this is the clearly indicating that the crude birth rate. Okay, where the crude death rate, where the total number of the death we are divided by the, so we are dividing with the mid-year population and we are making a multiplication into by 1000. Okay, so multiplication by the 1000, so that is indicating the crude death rate. So option B is telling that a total option B is telling the total number of the death from a specific disease divided by the total number of the cases of the same disease into 100. Okay, so this one is the multiplication by the 100. So this is how we have to say this is the case fatality rate, and who all are chosen the option B as the correct answer. So your answer is correct here, sir. How we have to say this one is the correct answer, sir? So look at the criteria what I told to you people. So there is the high fatality means more death will be there, and low fatality means less death will be there. Okay, so here the case fatality rate is what we are deciding. Like we are taking a, for example, we are taking a example of the TB disease. Okay, so here the total number of death by the TB, okay, and the total TB cases into we are making the 100. Okay, so there are consider in community total 1000 TB cases are you consider. So among 1000, if the 700 cases are dead means, so it's a very highly dangerous and highly fatal cases. Okay, so that is what we have to say based on the death of the specific disease. So we can say that one is the case fatality rate. So particularly comes to the case. So here a total number of the death due to the specific diseases, that may be a TB, that may be anything. Okay, divided with the total number of the cases of the particular that disease means the total number of the TB cases. This is what it actually what it explains the case fatality rate. So hope it is clear to you people, and the very important question. Okay, it's a very important question for your upcoming exams, right? So here is the next important question. The question is very simple. The question is very simple. Which of the following is an example of the primary prevention? Bacho, there is no nursing exams without asking the level of prevention questions. Okay, so in the level of preventions, we used to study the primordial prevention, primary prevention, secondary prevention, and tertiary prevention. Okay, so among these, every time in the all exams, there is chance of the asking the one or two or three questions. It will come from the one single particular topic, that is from the level of prevention. So if you understood the level of prevention one time, means fix 1 to 2 questions in your pocket. Okay, so it's very simple concept. I will teach you here with a very clear manner, so it will be fixed in your mind for the long term, and I will differentiate the examples very importantly, so that is much necessary for the upcoming competitive exams. Okay, so which of the following is in the example of the primary prevention? So I am expecting the correct answer from the every one of my students, so please do fatapat comment in the comment box. So option A is telling screening for the cancer in a high risk population. So we are doing the screening, means we are trying for the early diagnosis. We are trying for the early diagnosis. Bacho, early diagnosis and the prompt treatment are the components which comes in the secondary prevention. So not in the primary prevention. So I am eliminating the option A here. So then comes to the option B, that is the administering the chemotherapy after diagnosis of the cancer. No, already the disease is happened and we are giving the chemotherapy, means we are giving the treatment. So just now only I told the early diagnosis and the prompt treatment is a case of the secondary prevention, not a primary prevention. So option A, B also I am eliminating here. Okay, then comes to the option D, that is the rehabilitating a person after the stroke. Bacho, so already stroke happened or that condition happened and the person gone into a such extent of the complication. So here we are doing the rehabilitation and we are restoring the lost function. So that is what we call as in the rehabilitation. So this is a component of the, yes, our tertiary level of the prevention. So option D also not our answer. So vaccinating the children against the measles, so this is comes under the specific protection. Okay, so this is comes under the specific protection, and the correct answer is goes to the option C here. Okay, sir, what is specific protection, sir? Just simply consider a child where we don't want the child to expose to a measles in future. Okay, if he is exposing also, we are keeping the ready-made antibody by giving the measles vaccine to the child. Means we are specifically protecting those childs from the measles. Same like the other conditions. From the oral polio vaccine, we are giving and we are building the immunity in the child, where if the child accidentally exposed to any kind of the polios, so he will be protected against that one. Means we are protecting the child specifically against the polio. So all the vaccinations are the examples of the our specific protection, and specific protection and the health promotion are the very important two components which will comes in our primary level of the prevention. So quickly, very quickly, we will discuss all the important points related to the level of the prevention, so that is much helpful to you people. Okay, so first I will discuss with the concept, then I will take you to the core words, then I will finish the this particular important topic. Okay, so let's me start with the concept here. First, if anything to happen, the risk factor should be there. Okay, so from the risk factor only the disease happens. Okay, from the disease only, yes, the complications happens. Okay, so this is how the things goes more. Okay, so here we are reducing the risk factor and we are destroying the risk factor, means we call this one as in the primordial prevention. We call this one as in the primordial prevention. Okay, so from the risk factor to the disease conditioning happening, so we are halting the progress of the we are halting the we are not allowing the disease condition to happening, means we are taking the interventions before the onset of the disease condition. So that is the primary prevention. Okay, so that is what is the primary prevention. So from the disease is now just the disease happened to consider. From the disease, it's going to the complication. From the complication, it goes to the disability or the permanent impairments. Okay, so here this is the disease and this is the complication. So in middle, we are taking the interventions and we are halting the progress of the disease and we are reducing the prognosis of the disease. So this is what we call as in the secondary prevention, right? So now just consider we have not took the secondary prevention also. So we have not treated the disease properly. We have not treated the disease in the early. So that is the secondary prevention also fail here. Then comes to the complication happen to consider. So from the complication, the patient will go to the disability. So here we are trying to restore all the lost health. So that is what we call as in the tertiary prevention. Hope the concept is clear to you people. So the question will comes like this. So a reduction of the risk factors, which level of the prevention? that is the reduction of the risk factor is the primordial level of the prevention. Okay, so the intervention taken before the onset of the disease is the primary prevention. The disease is here, and before the onset of the disease, we are taking the intervention. So that is the primary prevention. The interventions taken to halt the prognosis or to stop the prognosis of the disease, that is the secondary prevention. Okay, so where interventions are there, where we are trying to restore the lost health, that is the tertiary prevention, where the long-term care rehabilitations will happen in the tertiary level of the prevention. Let's quickly revise all the level of the prevention. Okay, the primordial prevention is the just I told. So here we are preventing the development of the risk factor. So there is the reduction of the risk factor is the primordial prevention. How we have to reduce the risk factor? We have to promote the health of in the diet and nutrition of the children. Okay, so we used to educate them what is the importance of the high carbohydrate diet, what is the importance of the low cholesterol diet. Okay, so low fat diet, everything we have to important we have to educate, and we have to make them very fit by reducing their risk factors. Okay, so then creating the smoke free environment, encouraging the physical activities, and encouraging to access the clean environment and water and sanitation. Okay, so these are the examples of the your primordial prevention. The examples are very important. Bacho, whatever the questions are coming in your exams, they are coming with examples. So these are very important. 5 points are most important to you people. So there's the reducing the environmental pollution is which level of the prevention. Yes, the examiner can throw the answer in front of you people. Okay, so that is the clearly you people have to say the answer as the yes, the primordial level of the prevention, the most important. And the next is the most important word is the that is the primary prevention. Okay, so what is the primary prevention? What is the primary prevention? Yes, just we have discussed the primary prevention is the intervention we are taking before going to the disease. Okay, if the things or the process goes to till the disease means, so that is not primary prevention. So before going to the disease only, we are taking the interventions. That is what you call as the primary prevention. Okay, so what the primary prevention says here, there is the it is defined as the measures taken to prevent the occurrence of the disease. Okay, so before occurrence of the disease we are taking the measures. So that is what you call as the primary prevention. In the primary prevention, two important things is there: health promotion, where we have to give the health education to the children. Okay, where we have to visit the school, and we have to go for the school health programs. Okay, so that is the most important thing in the health education, the health promotion. Okay, so then comes to the specific protection. Here the questions will start. Okay, very importantly in the specific protection, vaccination it will comes. Okay, then prophylactic prophylactic antibiotics. Okay, so and many more. So very importantly, what you have to know is, so that is a vaccination. Consider we are giving vaccination. Just a second, please. I think the result of your prelims exam is announced. So please, at the end of the class, so everyone be cool, calm, relax, and watch your result. And whatever the result it may be a your result, or it may be a any other result. It may be a positive result, it may be a negative result. Accept it. And if you got the positive result, okay, so be motivated, stay connected, keep learning the things, keep updating the knowledge, and give best shot in the mains exams. And if it is your a bad result, so always you people have to be motivated. Okay, so don't go into the depression. Why? Because the things, negative things, takes you to the down only, not ever, never ever up. Okay, so always in the step life of yours should be one step towards your upgradation, not going to the negative things. Okay, so with this one we'll start the class, right? So right, a specific protection where the vaccination is considered. We are giving the vaccine against the human papilloma virus, right? So here we are giving the one HPV vaccine, means very importantly we are protecting a particular woman or the man who is about to expose with the HPV, human papilloma virus, and who is about to go for the cervical cancer and the genital warts. So we are giving the HPV vaccine, means we are specifically protecting that particular age group child or the girl or the boy. Yes, the HPV vaccine is given to both girls and boy. Okay, so right. Then the most importantly, where we are specifically protecting by giving the vaccination to the girl or the boy. Okay, so here we are protecting specifically against the cervical cancer. Okay, so that is the reason. Just a second, please. It's making the disturbances, right? So then comes to the specific protection. That is the prophylactic antibiotics. Okay, so most importantly, therapeutic antibiotics means we are using the antibiotic for the treatment purpose. So the disease has happened, then we are using the antibiotics, means that is goes to a secondary prevention. So here the prophylactic antibiotics are the things where we are giving a most importantly we are giving a antibiotic to prevent the disease. Okay, so that is what we call as in the specifically we are protecting against before onset of the disease. So that is also prophylactic antibiotics comes under the our primary prevention. So then the most important thing where the we will encourage the person to wear the helmet who is riding the bike. So we will promote the helmet where we are specifically protecting. The risk is there, the bike is there with the person where he is going on the national highways, so the risk is there. So means before going to the impact or the bad conditions, we have to protect him specifically. So encouraging the helmet is also a very important part in the primary prevention. Hope it is clear to everyone on the primary prevention. Okay, so then comes to the most important thing, that is the secondary prevention. In the secondary prevention, what happening? Secondary prevention refers to a measure taken to detect the disease early and to begin the treatment early. Okay, so the early diagnosis and the prompt treatment is the very important and best components of the our secondary prevention. Okay, so here the early diagnosis means disease is not gone into that extent where it may cause the complication. Still the disease in its early stage, so we are identifying the disease by early diagnosis. For example, so in order to screen the cervical cancer, we are doing the pap smear test. In order to screen the breast cancer, we are encouraging the mother to do the very important breast self examination. Okay, so here we are trying to early identify the disease and we are trying to give the prompt and correct treatment to that one, means that is the things will comes under our secondary prevention. And almost all screening test. Okay, so regular blood pressure checkups for the hypertension and the pap smear test and the blood sugar test, which comes under the our secondary prevention. And the proper treatment where the therapeutic antibiotics and DOTS therapy for TB and other drugs. So that is also most importantly which will comes in our secondary prevention. Okay, hope the concept is clear. Then comes to the most important tertiary prevention. In the tertiary prevention, what happens? Yes, so the diseases happen and the complications are started. We are trying to restore the lost health. So that is what we call as in the tertiary prevention. Hope the concept is clear here. So in the tertiary prevention, so the action taken to reduce the impact of the already established disease. Okay, so the disease is already established, so we want to reduce the impact of the disease, and so we want to recover from the disease. Okay, so most importantly we are encouraging for the rehabilitation, means we are restoring the abilities of the person by making some physiotherapists, by making some the reconstruction things like for example the femur fracture happened, means we are going for the head of the femur prosthesis. Okay, so that everything it will comes under the our tertiary prevention, and that is the long term cares also a part of the tertiary prevention. Okay, so hope the level of the prevention is clear to you people. Then here is the next most important question. So that is, which of the following is not a principle of the primary health center? Okay, so here everyone know that is the PHC. PHC, that is the primary health center. Okay, so which of the following is not a principle of the primary health center? So previously there are four principles of the primary health center. Now we are having the five important principles of the primary health center. Okay, so here very importantly we are having the equality to the every persons who is coming to the PHC. We have to treat them equally. Okay, like a Gram Panchayat member is coming to the PHC, you are giving a huge respect, and you are giving a separate bed, and you are giving the extra care. And one poor person who is coming to the PHC, you are neglecting to that person. This kind of the things should not happen at the PHC level. Okay, so whatever the care you are giving at the PHC level, that should be equally or equitably distributed to the every person and part of the community. Okay, so that's there is no any discrimination based on the gender, based on the economic status, based on the color, whatever it may be. Okay, there should not be any disturb. Okay, there should not be any differentiations, right? So then comes to the option B, that is the community participation. Okay, so this is also important part of the PHC component, principal component, where to make the all the programs to be implemented in the community participation is most important, where we have to take a help of the Gram Panchayat member, also the waterman, the water supplier of the that particular village, and ASHA worker of that village, and ANM of that village. Everyone, all the community members and all the health promotion members team should be equally participated in the every part of the our national health program implementation. Means then only whatever the government implementing the budget on the national health programs, that becomes a gives the result. Okay, so the community participation is most important. Okay, then comes to the intersectoral coordination. Okay, just I told, so the PHC should coordinate with the Gram Panchayat. Okay, so Taluka Health Center. Okay, then comes to the ASHA workers, sub centers, Anganwadi centers. Okay, so in the our health sector, where we have to communicate with everyone, so then only the things will change in the community. Okay, so the intersectoral coordination is also an important part of the our community, our PHC. Okay, principles. Okay, high technical specialist is not required at the PHC level. Okay, these are the very important five principles of the PHC, where first one is the equitable distribution. We have to distribute everything equally to the all part of the community. Okay, there should not be any gender based biases. Okay, there should not be any 18:20 ratio. Okay, so there should not be any gender based biases. Then the community participation. Okay, this is not related to the PHC, just for the right. So hope you people understood. Okay, so then option, sorry, the second point is the community participation. I have explained the thing. Then the intersectoral coordination, then appropriate technology, where the technology should be affordable in the low price and highly effective at the community level. So that kind of the technology is required at the PHC level. Okay, so then the fifth point is the comprehensive and integrated services also. So we have started to give at the PHC level. Okay, so these are the five very important component on principles of the PHC, and which is most important, bacho. So don't neglect these things, right? So here is the next important questions in front of you people. Okay, what is the population norm for the primary health center PHC in the hilly, tribal, or the difficult areas according to the Indian public health sector? According to the IPHS, so according to the Indian public health sector, so we have divided the PHC based on the population. Okay, so in the hilly areas, in the tribal areas, or the difficult to reach areas, so what is the one PHC covers how much population? Option A 10,000, option B 20,000, option C 30,000, and option D 50,000. So which is the correct answer? Yes, I'm waiting for your response. This is the frequently asked question in your exams. Okay, so the 20,000 goes the correct answer here. Bacho, look at this one, a very important chart, where most importantly subcenter covers the 5,000 populations in the plain areas and 3,000 populations in the hilly areas or the tribe areas. Right? So subcenters nowadays we call this one as the Ayushman Arogya Mandir, right? Then the PHC, the primary health center. In the hilly plain areas, it covers the 30,000 population, and in the hilly areas, it covers the 20,000 populations. Then the CHC, the community health center. In the plain area, it covers the 1,20,000 people population, and in the hilly area, it covers the our very important 80,000 populations. Okay, so the question will come from here. So the question just previously asked was the PHC at the tribe areas. So that is the answer is 20,000, and we have chosen the correct answer. So that is the 20,000 here. Okay, so the concept and thing is clear here. Okay, so here is the next most important question. What is the full form of the ASHA? The simple question and important question. What is the full form of the ASHA in the context of the Indian healthcare? Option A, accredited social health activist. Option B, active social health assistant. Option C, associated state health advisor. Option D, allied services health agent. What is the correct answer? Yes. So almost all people have chosen the correct answer. That is the accredited social health activist is the full form of the ASHA worker. Okay. So what is ASHA? ASHA is the a female who is work at the village level. Okay. For every 1,000 population, one ASHA worker will be there. Accredited social health activist will be there. Okay, so she works under the program of the National Rural Health Mission. Okay, in the village level, Anganwadi worker also come. In the village level, ASHA worker also come. But Anganwadi workers, she works under the program of the ICDS. That is the integrated, yes, child development services. So in that under that one, the AWW, that is the ASHA workers, they will work under, sorry, the Anganwadi workers, that is the AWW is the Anganwadi workers, she works under the our ICDS scheme, that's the integrated child development scheme. But the ASHA worker, she works under the NRHM, and Anganwadi workers works under the, yes, ICDS. That is the NRHM is the National Rural Health Mission, where the our accredited social health activist she is working here. Okay, so she will be selected for the every 1,000 populations. So here is the criteria to select the ASHA. Okay, so this is most important for your upcoming both RRB exams and upcoming your both Norcet mains exam also and RRB exam also. Okay, so the age of the ASHA should not be more than 45 years, and she is between the 25 to 45 years of the age. So this is the first criteria, most important criteria. Okay, so 25 to 45 years of the age, and she should not be more than 45 years of the age. Okay, so then she should be a resident of the same village. Okay, so if ASHA is coming from the Bangalore to the Tumkur, or she is coming from Bangalore to the Hyderabad to work, this kind of the things will not happen. Yes, the ASHA should be a resident of the that same village only. Okay, so she should be a resident of the same village. Okay, or like nearby community is accepted. Okay, so always preferred will be the same village. Then the next education. So in your old K Park book they have given the 8th. Okay, so now preferable is the 10th standard is the preferable. If not available, we can go for the 8th class also. Okay, if not available only, if not available only, so we'll choose the 8th standard as the answer. Okay, so here the ASHA should complete her the 10th standard. If a woman is not available, who or she is completed the 10th standard in the village, so there is no way to us, so we have to choose the a woman who completed her 8th standard. Okay, so it's a very important. Then comes to the health status. So always the ASHA worker should be free from the all communicable diseases, that may be a TB and other all important diseases. She should be free from all these diseases. Okay, so then only she considered as a fit to work as a ASHA worker. Okay, so that is the very important, right? So hope it is clear. Then the most important thing here, AWW, question from the AWW. According to the Indian government guidelines, how many people are typically covered by one Anganwadi worker? Bacho, by the one Anganwadi worker, by the one Anganwadi worker or the one AWW, okay, in a rural areas. So she should cover how many populations? Option A, that is the 400 to the 800. Option B, this is for the ASHA worker or the female health worker. Okay, so ASHA worker and female health worker is chosen for the every 1,000 population. Okay, this female health worker, so we can call her as the that is the lady health visitor also. Okay, so LHV also we can say. Then comes to the next, very importantly, 2,500 population should be covered by the one USHA worker. That is the urban social health activist. Okay, so this worker, previously I told Anganwadi worker, she works under the ICDS, ASHA work under the NRHM, and USHA work under the yes, which program? That is the National Urban Health Program. Okay, under the NUHM, the USHA works. Okay, so this is the very important population, and one Anganwadi worker in a plain rural area, she covers the 4,000 to 8,000 population, and in the hilly area, she covers the most importantly 400 to 800, and in the hilly area, she covers the 300 to the 900%. Okay, so this is the most important thing we have to choose as a correct answer. So here the only one option is correct, that is the option A. So our best answer is the option A. The next very important question is here. Yes, please do read the question completely till the end, then try to give the best answer for this one. If any voice disturbances is there, I will cover. Don't have to worry. So if anything is happening technically, I will explain repeatedly. Okay, don't worry about that one. If you didn't understand anything, so you can comment in the comment box. So I will respond and repeat again. Right. So the thing is very clear here. The administering the lethal dose of the medication to end the someone's life who is suffering from the cureless and painful diseases. Okay, so is an example of the what? Option A, administering the here the administering the what we are doing, the lethal drug means the dangerous drug dose we are giving to terminate the someone's life who is suffering from the cureless and painful diseases is an example of. Okay, so there is a person where he is having a one terminal disease where he is unable to recover from that one, and recovery is not possible from that particular situation, right? So here, as a healthcare professional, with the consent of the patient, legally we are giving the lethal dose of the medications to terminate that particular person's life. Okay, so what we call this one? Option A is the passive euthanasia. Option B is the active euthanasia. Option C is the assisted suicide, and option D is the natural death. What is the answer? Yes, Bacho, there are two types of the euthanasia, where one is the active euthanasia and another one is the passive euthanasia. Sir, what is first euthanasia? Euthanasia is the terminating a life of an individual who is suffering from the cureless and very painful diseases. Okay, so where he is unable to bear that kind of the pain, and there is no treatment for that particular disease, where he have to die in a some up to like 15 days and 20 days. So in order to reduce their sufferings, so we are terminating the life of the patient. So that is what we call as the euthanasia, right? So in the euthanasia, the two important things comes. One is active euthanasia and another one is the passive euthanasia. One is active euthanasia and another one is the passive euthanasia, right? So in the active euthanasia, we are giving some medicines or some lethal drugs to end the life of the patient. So that is what we call as the active euthanasia. Okay, so here we are deliberatingly we are giving the injections, that is the lethal suicidal drugs to terminate the life of the person, that is the active euthanasia. Okay, so here we are actively involved to terminate the life of the person. Okay, for example, doctor gives a lethal injection, so the patient will terminate his life. Then what is the meaning of passive euthanasia, sir? The passive euthanasia is like the patient is suffering from the very dangerous disease of the lung cancer. So here we have to keep him as on the ventilator. But we are not keeping him on the ventilator. Means here we are not giving any medications. Okay. So we are not actively or directly involved in the terminating the life of the person. Right. So here what happened is just we are withholding the thing, so that is supporting his life. So that is what you call a passive euthanasia. Okay, so here also the thing is same. Here administering the lethal dose means we are actively involved in this one. Okay, that is the active euthanasia goes to the correct answer for this one. Okay, so hope that today's class is clear to everyone, and the remaining class will continue in the tomorrow's class. So all are wants to become a part of our test series and the important classes, so please do subscribe to our channel, YouTube channel, and download our Master Nursing Classes app. So in the tomorrow's class, the class will go lengthy because it's completely targeting over the RRB exam and the upcoming Norcet mains exams. So we will meet again in the tomorrow's class. तब तक के लिए जय हिंद जय भारत. Don't be go into the sadness, don't be depressed, so because the negative things never ever give you a positive result. Okay, so to become a positive man, always to be keep your mind fresh, accept the whatever the thing is which is coming, and all are got shortlisted. So don't go into the euphoria where you will stopping the study. So just you have cleared the one step of your exam, so the next step is awaiting for you. Okay, so keep preparation strong. Okay, believe in yourself, everything is possible, right? So the whatever the motivational quote I have told to you people in the starting of this class is that is, if you are going slow is also okay, but you are stopping the thing, that is not okay, right? So it does not matters to how slowly you are going. It matters, and which brings the negative effect when you stop the thing, right? So never stop in your life. Keep moving and accept the result and learn the thing which is coming to you people, then move on. Okay, so that's it. So we will meet in the tomorrow's class again with a beautiful content. So तब तक के लिए जय हिंद जय भारत. Keep loving.